Okay, welcome. My name's Stuart Ralston. I'm chairman of the Paget Association, and I'd like to welcome you to this video, which is part of a series of video interviews we're doing to mark Paget's Awareness Day 2023. And this Awareness Day is a very special one because 2023 is the 50th anniversary of the Paget's Association. And the theme of Awareness Day this year is the patient experience or the patient perspective, and also what the association has been doing to support people with Paget's, raise awareness and fund research over the past 50 years. Okay, so it's my great pleasure to welcome Sheila Murray, who has got Paget's disease, also a member of the association, who lives in the lovely Scottish island of Bute. So, Sheila, thank you very much for joining us today.
Pleasure.
Thanks once again. Well, maybe we could start if you could tell us what you first noticed, what made you think you may have Paget's disease, or at least what made you think there may be something wrong.
Well, probably in my late 40s, early 50s, I was putting on winter boots, knee boots, without zips. They were pulled on, and I noticed the right leg all right, but the left leg just wouldn't go up properly. And because my mother had Paget's and my grandmother, and although it was called tubercular hip in those days, I immediately thought, I sort of half expected, will it come to me? So I wasn't too surprised, but I thought, well, I'll go to the local doctor and send him. So he said, an x-ray will determine this. So I had an x-ray and he said, yes, indeed, you have got Paget's. Any pain? I said, no. He said, right, that's fine, just go away and forget it. So that's more or less how it started. But the Paget Society, my daughter's friend was doing a nursing course, had heard that I got it and said, there's a society. And she gave me the address and I was a bit reluctant. I thought, do I want to belong to this? But I'm glad I did. And that's when I noticed in the first newsletter that a doctor in Glasgow was interested in anyone with a family history or with daughters or whatnot. So I wrote, and I think that was your boss, Dr. Boyle, and I got a letter back from him saying that he was passing it to another doctor, yourself. So that's how we met. I had a letter from you and you said the only thing was you were moving to Aberdeen. So that's why I went up to Aberdeen quite happily in my Easter holidays.
Okay.
That's the beginning of it all.
That's a good story. Well, yeah, it brings it all back. So that's very interesting, actually. So your leg obviously was bent a little at that time because of the boot, but you didn't actually have really pain or anything very much.
No.
Now, I recall, I think, I remember seeing you in Aberdeen, and I think at that time the tibia, as it's called, the shin bone, was bent. Did you have treatment at that point in time? I think we were using a drug called pamidronate. It was a drip. Do you recall having that, or do you remember your experience with it?
Yes. My husband and I came up for a weekend and you said you'd be there on the Saturday morning and you took blood from us both and said that you were interested to try a drug called pamidronate. And so I agreed to come up a few weeks later in the Easter holidays. And that's when it all started. But I had no ill effects whatsoever. You did say it might be a slight feeling of fever, but I never experienced that at all.
And then I think you had a couple of doses, and I recall you were a participant in the PRISM trial. Thank you for that. But then I've obviously been moving around Scotland, and then I came to Edinburgh, and I've been there for the past 14 years, actually. And so your train trip has relocated from Bute to Edinburgh instead of Aberdeen, which is a bit nearer. Have you had treatment more recently? I think we probably are using zoledronic acid or zoledronate now. Is that a treatment that you've had? And again, what's your experience with it?
Yes. Well, it would be pre-COVID. And I had no ill effects whatsoever. I remember you saying, I'm moving to Edinburgh, that will make it easier for you. I thought, no, it won't, because I enjoyed my overnight stay in Aberdeen, got to know the art gallery and even went to the theatre one time from the hospital and came in late and found the door was locked. So, I enjoyed my Aberdeen trips.
Okay. Now, I think even despite that treatment, I think, knowing you as a patient, I think that the shin is still bent, but of course we know that once the bone is bent, treatment can't unbend it. I was speaking to another patient with Paget's who had surgery for the bone. Is that something you would ever consider? Or I think I may have raised that at one point in time. But your thoughts?
Yes, I did. I think I was referred to the Edinburgh Hospital, not yours, but the other one. And I was seen by a doctor who wondered if I was walking not quite straight, that one leg wasn't quite in alignment. But at that time, my daughter was moving here to the island, and with a 3-year-old who was about to start nursery. And I suddenly thought, oh, I don't think I want to be laid up with a broken leg. So I didn't do anything about it. And I don't regret it because, as I say, I have no pain. I wear trousers all the time and I'm not, it's all right.
Okay, thank you. Well, that's a fair enough reason. Obviously, important to think of your family and grandchildren. Okay, one last question, Sheila. You have mentioned that you've got grown-up children, and I mean your family history very definitely demonstrates that Pagets can run in families and can be passed from one generation to the next. Is that something that your children are interested? We're doing some research in this, or at least in Edinburgh. Is that something your children are interested in, or what?
Yes, my daughters are twins, and the one twin, one with the family, she was quite intrigued to undergo this. So she has been over to Edinburgh on one occasion. She has been already. Mm-hmm.
Okay, so she must be taking part in the GAP DPD
Yes,
study. Mm-hmm. Excellent. Well, that's a brilliant plug for our research. Sheila, it's really great to talk to you. You have got a very interesting story. Thank you for your contribution to the video series today. And yeah, so thanks once again.
Oh, thank you. Thank you.